The following video will cover the complete BMD report and how the contents are generated. Note that there is a complete BMD report as well as a concise BMD report. We'll begin with the complete BMD report. The format of the complete BMD report is based on Appendix 7 of the CAR reporting guidelines. The report begins by referring to the referring physician. There is a preamble indicating that the patient had a BMD test on a given date using the Prodigy system in this case, as well as the serial number of the system, as well as the analysis version of the software. Begins with the patient biographical information, which comes from the Encore software. The menopause age comes from the Dexadesk questionnaire interface listed above. BMD facility name comes from the software. The diagnostic category is based on the lowest T-score of the exams sent to PACS. The fracture risk is generated based on the history used for fracture risk determination listed below. Please note that as per the recommendation of the guidelines, male patients will have the femoral neck T-score adjusted as if they were a female patient. The BMD data will list all the exams sent to Dexadesk, as well as the regions used to generate the lowest T-score, which ultimately leads to the diagnostic category. The reference used for diagnostic category, as well as fracture risk, are listed here as well. In cases of a follow-up patient, changes in patient demographics are also listed, as well as changes in density. For changes in density, note that the exam completed today is listed first, followed by the previous exam result, the exam closest to treatment start date, as well as the baseline exam. As all these BMDs are known, columns are provided to give information on the changes in grams per centimeter squared, grams per centimeter squared per year, percentage change per year, if it's significant, as well as the least significant change value. A comment on the change in density is automatically generated if there's a net gain or stability in density. If there's a net loss, another comment is also provided indicating the opposite. Further study limitations, major risk factors are also generated, as well as the interpretation of the report based on the fracture risk of the patient. Note that this text is customizable as may be the requirements of your facility. After the interpretation, a follow-up date is also suggested, indicating the month and year as per the guidelines. Note that there's a follow-up paradigm for both Ontario provincial recommendations as well as the KROC recommendations. The report ends with the definition section. There is a definition for T-score, for diagnostic categories, for fracture risk, for the KROC 10-year probability of fracture. There's also exam and region-specific precision errors and LSC. There's a definition for KROC, total body less head, and LSC. Lastly, the DEXA manufacturer, product model, and serial number also appear at the bottom of the report. Depending on the requirements of your workflow, this report can be sent as an image to PACS, it can be manually copied and pasted into a RIS or dictation software, or by clicking Finalize and Send, or even Finalize and Send All, this report can be integrated directly into dictation software. You'll notice that it will arrive pre-formatted the way you see it in Dexadesk. This allows you to review the BMD report rather than draft it from scratch. This will also help to eliminate transcription errors and improve the efficiency of your BMD reporting.